This is Dr. Jason Browder, simplifying manual medicine by putting principles into practice. Today we're going to demonstrate Ed Stiles' form of sequencing by using the spinal sweep. I do want to emphasize that Ed Stiles never called the spinal sweep the spinal sweep. That is a term that Paul Johnson and I have designated to identify it as a portion of our book, Introduction to Manual Medicine. Today we have our lovely model, Dr. Diane Medella, who will help us in this demonstration. So what we're going to do in the spinal sweep is we're going to introduce type-free motion via Fryette's laws, and we're going to introduce side bending, rotation, and actually extension in this. Ed Stiles did a version of this where he'd have the patient standing, and he would introduce flexion and then introduce side bending and rotation. I prefer to do it seated, however. The middle of the patient's spinous process is indicated by this red line. What we do to begin is we put our right hand on the right shoulder, and then our left thumb right next to the spinous process in the paraspinal gutter. And what we introduce is extension, side bending, and rotation in a single motion. And down, and we test the whole spine. Then I come back across. Again, left hand on the left shoulder, the left thumb on the paraspinal gutter, the left paraspinal gutter, and I introduce side bending, rotation, and extension in a diagonal vector across the patient's body. What this does is it simultaneously locks multiple facets and allows us to evaluate an area of 4 to 6 levels at the same time, increasing efficiency. So what I want to emphasize by using Ed Stiles' spinal sweep is that it doesn't identify a level of somatic dysfunction. It identifies an area. So if I identified, for instance, up in this region, and as I move out more lateral, I would think that there's a rib dysfunction, and I would take the patient, I would lay her down, and I would check rib cage. If I identified something down in this area, it could be lumbosacral or lower extremity, and I would have to evaluate that area. So the spinal sweep in Ed Stiles' sequencing doesn't tell us an exact somatic dysfunction. It identifies an area of greatest restriction, and then we have to go in and do our further testing at that time. So I hope you enjoyed this video on Ed Stiles' sequencing method. Again, this is Dr. Jason Browder, simplifying manual medicine by putting principles into practice.